Now more than ever, the public and private sectors need to work hand in hand to not only curb the spread of COVID-19, but to also ensure a bounce back of economies globally after the pandemic. But how practical is this? Now, on this CNBC Africa special, we have a panel of experts to help us break this down. And my name is Arnold Kwizera. And if you want to contribute to this conversation, tweet us at CNBC Africa, or you could tweet me directly at The Real Kwizera. Now, joining us on this panel is the UN Resident Coordinator in Kenya, Siddharth Chatterje, Polman, a chairman of the International Chambers of Commerce and former CEO of Unilever Group, and Myriam Assa Sidibe, an associate professor at Harvard Kennedy School and also a co-founder of the Global Handwashing Day. I would like to start with you, Mr. Siddharth. Now, sometime back, the UN Secretary General had called for a global collaborated response to the COVID-19 pandemic. And looking at the European Union as an example, did we miss the window to work together? Thus, a great opportunity to mitigate the spread of the virus.
Well, thank you for that question. I would say we didn't miss the boat at all. In fact, on the contrary, the Secretary General and the Deputy Secretary General, Amina Mohammed, have been very clear about the importance of global partnerships in dealing with the COVID crisis. And as the Secretary General often says, we are all in this together and we will come out of this together. Here in Kenya, for example, we have a very strong and robust partnership with the European Union, a gentleman by the name of Ambassador Simon Mordu, who leads it. And we've actually been working together right since the very inception, right from the very start of this crisis, but even before that. And as a matter of fact, we've aligned our efforts to have maximum impact. And this includes not just the European Union here, but the member states of the European Union. So on that count, I think we are moving quite well. Over to you.
I want to bring Paul into the conversation as well. Paul, do you believe we missed the window there? Siddharth is being very optimistic here, but could it have been curtailed earlier?
Well, what Sid is obviously in Kenya, and they're doing an amazing job in working with the government, working with the private sector, and then obviously the UN itself under Sid's leadership. The African continent had a little bit of an advantage, that it had an early warning system and probably less people traveling in and out. But it is clear that the moment we heard about the crisis in China, and then obviously with the enormous amount of travel that is happening towards Europe and the US especially, that we see quite a difference between countries that reacted fast with a lockdown and early prevention measures, and that countries that were trailers. Countries like the Taiwans or the South Koreas, or the Singapores, if you want to, or in Europe, the Nordic countries or Germany were pretty fast out of the starting block, and they've actually seen less cases. As you know, we just passed, as we do this broadcast, 3 million cases officially globally and 200,000 deaths. And most of them are actually in countries, not in Africa or not in the ones that took preventive measures fairly quickly, but in the countries that were late to the game. We have 1/3 of the death in the US, more or less at the rate we're running now, and Southern Europe has been heavily hit as well. Europe could have done two things better, but I think we have some time for post-mortem when the crisis hopefully is under control globally. But one of the things coming out is being better prepared. And the second thing I would say is a better global coordination. The black swan here is actually not the virus itself. We're getting viruses every 4 or 5 years. You've had a fair amount of those in Africa, 75% of them actually coming from animals. So the fact that we are destroying nature and get an encroachment on the animal world is haunting us. But the reality is that our global coordination is really the black swan. We have seen a lack of governments working together. Even here in Europe, where I live, the response to help the Spains or the Italies has been appalling, and many people are questioning if Europe is about sovereignty or solidarity. And I hope that on the global level, coming out of this crisis, we will show more solidarity to be better prepared if the next one comes.
Myriam, bringing into the conversation there, Siddharth initially looking very optimistic Paul is saying that this could have been better coordinated, we could have done, and possibly we may have missed that window. Myriam, what's your take on this?
I think, look, I'm sitting in Kenya today, and I'm looking at, obviously, the global pandemic from a ground stage in Africa, where I'm looking, and it's very clear that if we don't put in place prevention measures at an accelerated pace, that what we will see in Africa is a tragedy. And this is where it starts becoming even clearer that there is an opportunity for novel ways of working that's going to pave the way for how we survive this crisis, but of course how we emerge from this crisis. And then I think, this obviously is very much aligned to what I've been, spending my career over the last 20 years, which is around, how do you get the private sector to really get involved in terms of health and hygiene and put its weight behind its muscle power to try to support governments and NGOs and UN around there. So I think, have we missed the boat? Not yet, and definitely not in Africa. We are in a place where we could put in place, very strong prevention measures, and we could take a really clear learnings and give this opportunity also a chance in Africa to be able to really come up with local solutions. And we've seen that. We've seen what Senegal is doing at the moment in terms of mass testing tests actually being done in Senegal, and seeing how that's actually being done. We've seen that in countries across Africa where, different kind of solidarity funds are being created, where, we are very clearly putting prevention and livelihoods working very closely together, because we know that lockdown measures that are being implemented in Europe would not be possible at all in an African context. So I think for me, this is the kind of conversations where this new type of partnerships would be absolutely critical in terms of how you're going to be able to prepare should the peak in a couple of weeks really happen in Africa, that we have, clarified and understood that what will actually enable us to get out of this crisis in Africa will not be what's being asked of Europe or the US at the moment.
Myriam, I want to stay with you there. You make some very interesting points. Now, for years, some of the world's leading scientists have predicted possibly a catastrophic fallout in case a pandemic such as what we are facing right now happened. Why didn't we listen to them?
Why didn't we listen to them? I think, I think this is definitely showing the fragility of our healthcare system, the fragility of our communications between borders. I think this, it's very antioxidant that everybody's closing their borders. When at the moment, what's really required is a sense of solidarity and learnings. And what we are doing, for example, in Kenya is very much about local implementation, global practice, learning immediately, with immediate rollout and learning. Why didn't we listen to them? I think it's a question that's beyond. I think maybe there's a sense of not understanding how vulnerable we could be. Nobody had predicted the strength of this virus and how it will hit in certain demography. I think that's something that we weren't prepared for whatsoever. I think an understanding of obviously how at the core of this is some very basic measures which would take so much to actually implement, and then the obviously the how this would actually hit not only families and daily life, but also the economy. I mean, why didn't we listen to them? I think it's been out there. All I can say is that out of this current crisis, we are learning how much more vulnerable we are as a society and as a country, and that their learnings is happening as we speak and being shared ASAP across countries. So whilst it's looking negative, I have never seen so much solidarity actually between institutions, ways of working together, because ultimately we're realizing that at the forefront of this is a society that needs to be healthy. And if not, then none of the other systems that we've created will actually thrive or survive.
Siddharth, bringing you back into the conversation, experts in some of the UN reports said, we are that vulnerable. And again, we didn't listen to them. What's your take on that?
Well, if you look at the speech by Bill Gates a few years ago, he accurately predicted that there will be a global pandemic. So it's It's taken place more regionally, but the scale of this pandemic mirrors that of the Spanish flu. So yes, I mean, whatever is said, but WHO did put out a warning about the scope and challenge that this particular pandemic, presents. But what it also goes to show that however advanced a nation's healthcare system is, unless we actually make sure that universal health coverage becomes not just a slogan, but a reality in every part of the world, universal health coverage globally will now mean the weakest link in the chain, because it's quite clear what COVID-19 has shown is sheer velocity, virulence, and speed with which it has overwhelmed world's health systems. And if we talk about the big five, it's the US, it's Italy, it's France, it's UK, it's Spain, where we've seen the devastating impact of this particular virus. Are we over the hill yet? No, not yet. And that is why for parts of Africa, and I go back to what Myriam said, our prevention strategy is going to be mission critical. But what now needs to do is for science to catch up, because it's quite clear that the finest scientific minds in the world are still grappling to find a solution to this. So, which means that all those issues that Paul talked about, we need to look at an entire ecosystem coming together in terms of a global prevention strategy, which includes early warning, the surveillance, but most importantly, what the Secretary General constantly talks about is the climatic degradation which is taking place and is presenting a major challenge to us. So we are not over COVID-19. We probably will overcome it now, but we don't know the ferocity of the next pandemic around the line. So I think it's a wake-up call for humanity in trying to deal with something very, very critically important. It was Cyril, the Greek philosopher, who once said that, the health of your population must come first. And I think global leaders should understand that this is what it's going to be. Over to you.
Very interesting take there and very realistic. Paul, there's been a mention by Sid of healthcare systems, and healthcare systems world over have been stretched out. Now, Sid makes a point that we should move away from the slogans. Yeah, and it's a very interesting point. How do we move away from the slogans, and what kind of lessons can we draw from this situation?
Very clear is that a few things were working, but many things were not. And one of the things that we were not very good at, unlike the crisis of the financial crisis in 2007, 2008, is global coordination. We have a world where multilateralism, unfortunately, has been in significant pressure. And, Ian Bremmer calls it G0. We have little cooperation. I think one of the issues with this crisis was that the information came out later, perhaps, than it should have been. And then cooperation in the beginning, and certainly even now still towards a continent like Africa, is less than I would expect from fellow human beings when we have a global crisis like this. What we've learned from this crisis, first and foremost, is that it is much cheaper to prevent these things and to be prepared for it than having to deal with the consequences. The world is now going to spend $5, possibly $10 trillion. Unfortunately, not enough is getting to Africa. That's a separate issue we need to talk. But $10 trillion, which with probably several billion dollars, could have been avoided if we were prepared. And that actually gets to the essence of the Sustainable Development Goals. We are now in a position, I think, to develop a growth model, having spent the $5 to $10 trillion, that hopefully doesn't go back to where we came from, but goes to a future that is more inclusive, that is more equitable, and frankly, more sustainable. And from all aspects that we look at, it makes total sense. Unemployment levels undoubtedly will go up as a result of this crisis. Many companies coming out of this crisis will have a hard time employing the same number of people as before. So we are in dire need for job creation. A green economy can create 65 million jobs. There are more jobs in the green economy than in the old fossil economy. We also need to have a social protection system that is better. We're now discovering that the most important people, the healthcare workers, the truckers, or the home delivery, the people that work in our supermarkets or in our food chain are probably the most vulnerable people in this world. And many of them don't have a social protection when things go bad. So in order to make this environment more inclusive, we need to redesign as well our social system, not only in providing, as Sid says, rightfully so, healthcare and better healthcare to everybody, but also providing safety nets in case we get these economic shocks. And then we need to find a new system of global collaboration so that we build in resilience, because undoubtedly we will get other pandemics like this. We've had SARS, we've had Zika, we've had Ebola, and many other things that we've had to deal with. This one is a particularly nasty one, but it would be very presumptuous from us to think that we won't get one in the future. So resilience there as well. Green economy, social protection, and a more resilient global governance system to deal with these issues moving forward.
Paul, you've been quite critical about the collaboration efforts, especially when you mentioned the lack of it in the European Union, the going at it alone, but also in terms of the government and private sector, that has seemed to be an issue. Now, why is it important for the government and private sector to work together in order to, flatten, first of all, the COVID-19 curve, but also importantly, to move the economies forward and recover?
Well, I think Tedros said it very well when he said that this is a whole of government, whole of society issue. There is no question that the challenge that we deal with here in saving lives in first place and then saving livelihoods needs everybody. We've seen the private sector step up very fast, in many places faster than the governments, to put protection things in place, to provide the PPE material, to bring the funds in or other products that were needed, and increasingly working in partnerships with government and civil society to address this enormous challenge that nobody was prepared for, and that is of such a magnitude that none of the individual partners can do it alone. That's why I'm so happy that both Myriam and Sid have taken an initiative in Kenya that is a model for many other countries. The SDG partnership platform that has been created in Kenya between the UN, which Sid leads there very capably, and civil society and the private sector, has come up with an initiative, the National Business Compact for Coronavirus, which has, at a very short period of time, rallied the private sector, aligned it with government policies, put funds behind it, but also resources, people, products, and solutions, especially when it gets to habit change, which is obviously the area that Myriam leads. And bringing that expertise together, like you now have in this wonderful panel, can lead to these breakthrough solutions that we're looking for. So partnership, indeed, partnership for the common good is the name of the game moving forward. But it is difficult if you're elected in a local country by your local people, if you have short-term election cycles, or if you have some presidents that frankly have been elected purely because of populism or discontent in societies that actually get to the roots of the issue that we need to address now.
Sid, why is this collaboration important between the government and the private sector players?
It was John Donne, the famous English literary. Can you hear me?
Yes.
It was John Donne,
yes,
the famous English literature writer, who once said that no man is an island, every man is a piece of the continent. It's very, very clear. That is why we have the Sustainable Development Goals, which talks about partnership. No country, no government, no institution can do it on its own. As we've seen today, the United States of America, one of the most powerful countries in the world, needs the private sector, needs civil society, needs the health workers, needs all institutions to come together to fight the COVID-19 pandemic. And this pandemic has shown that without global partnerships, without public-private partnerships, without government, public sector, private sector, the people coming together, we will not be able to achieve the kind of scale and destructive nature of such pandemics. And on the flip side of this, the creativity, the global economic growth, the cross-pollination of economies and nation states is what is going to turn these economies around. And we've seen that post Second World War. Look at the evolution and dynamic speed of Europe. They were able to reap a demographic dividend. They came together as nation states and saw the value proposition of governments uniting under the European Union flag. And look at the progress that Europe made and pulled everybody out of poverty. When you look at post-Second World War Europe, which was completely devastated by the consequence of not just the war, but the Spanish flu as well, look at the recovery. And I think this is precisely what is needed. And that's precisely the reason there's a sustainable goal number 17, which is about engendering, nurturing, and making sure that these partnerships work. Over to you.
Sid, I want to stay with you. There's going to be a total fallout of some companies, while also an opportunity for new ones to be created. Now, will this begin the creation of a new economic world order? And if so, what are the options for an exit strategy for governments?
Interesting question. Let's look at what happened after the Spanish flu. And one of the things that the Spanish flu actually did was it was a preponderance of men that died. You know, this was post First World War. It was a time when soldiers and sailors and all were coming back to their countries, and a lot of them got killed. What happened was women stepped into the workforce. And these very women started becoming the engines of the economic growth in the United States, in Europe. Frankly, what it did was repurpose the way society looked at women. So I see, if I were to wear a gender lens, I would say this was a critical outcome of the ravages of the Spanish. Now what is happening is it's quite clear. Regardless of the might, regardless of the weaponry, regardless of the economic strength of nation states, today there are about 30 million American citizens that have applied for unemployment benefits. We don't have those social safety nets in Africa to be able to provide that kind of a service. So it is clear that now is the time for, should I call it the Renaissance of multilateralism in its real sense, because no country can now manage to do it alone. It's clear that, you had China helping out in Spain and in Italy and in Great Britain, and vice versa. I think human society is getting far more interconnected. Just as we are technologically interconnected, we are now far more interconnected through health, because this one pandemic has shown to us why the SDG, which SDG 3, which is about universal health coverage, now becomes mission critical. Because ultimately, every economist will tell you the health of a nation is a wealth of a nation. Nobody differs on that point of view. And this perhaps becomes the harbinger of that renaissance that I'm talking about. But at the center of this is going to be a new sphere of multilateralism, which will be the United Nations, which will be the private sector, which will be governments all coming together for a global good, which is about advancing development and advancing humanity.
Sid, thinking it's a universal health strategy there is very critical. Myriam, what do you think is the exit strategy there for the private sector?
Well, I think, to go back to what Sid said in terms of the type of partnerships, and I think it might be good to deep dive a little bit on what we're currently doing in Kenya as an example of, for the National Business Compact, and the fact that you could put very quickly at the heart of the conversation, what are the prevention mechanisms that's required in order to prevent the spread of COVID-19, and how do you harness not only core businesses, but also philanthropy and policy engagement. So how do you put these three together to be able to come up with a strategy that's today, and then what it will mean to rebuild the businesses in the future? I think, if you look at what we've done with the National Business Compact over the last, 5-6 weeks that it's been in existence, and already, putting messaging over, 45% of households in Kenya, so 1.8 million households have been reached by the messages that we put, is to acknowledge very quickly that, if you're going to be talking about hand hygiene, which is the best line of defense when it comes to COVID-19, if you're going to be talking about wearing masks, if you're going to be talking about physical distancing and what does that mean in an environment in Nairobi or in Kenya where people are dealing with, close proximity and, livelihood issues. What exactly does that mean, and what is the role of some of these core companies that are out there that are, one, supplying the soap, to supplying some of these PPPs, and three, making sure that, from their communications can really drive some of these prevention habits at the core of the conversation. So what we've done is to say, look, let's set aside a bit of the competitive nature, but let's put together the best of what everybody has to bring to the table, from the supply of the soap all the way to the fingertips that need to use them regularly, and making sure that what we're thinking about is a holistic ecosystem that is really looking at how people need to wash their hands regularly, where the access of the soap and the water is going to come from, and then do we create a place where they live, where they will be able to do these prevention mechanisms in order to really embed this in the way that they're going to be able to live a life with COVID, because that's what we're dealing with at the moment. We don't know when this crisis will end. Therefore, we can't just be only thinking from an emergency and humanitarian perspective. We still need to think that, with this in line, that we are creating systems that should enable every family, every household to be able to practice these behaviors sustainably, so they can keep themselves protected until we have a vaccine in place, or a different testing ground that we're looking at. So if I think about what the exit is, I mean, what you're looking at today is rethinking. What does it mean to do responsible marketing during this time? Because it's going to be absolutely critical that companies are standing up and really, doing the best of what they do. If you are a soap company and you're getting people to wash hands with soap, you've got that century experience of having done that. And that's absolutely critical that we put all of them together and say, what is it? What do we do? Is the answer flooding the market with free soap? Not really. Is the answer having an understanding of market-based solution whilst keeping in mind that today we need to get to a point where affordability, accessibility, and complementing all these approaches coming together become key? Absolutely. So I think it's about rethinking more than ever, how do we get to the furthest behind at this point to quickly, so that when we get to a point of accelerating some of the prevention measures, everybody can practice it. And I think that's a new way. So any company that hadn't thought through all the way to the vulnerable is having to accelerate its thinking today to say, well, there will be no market for me tomorrow if I have not identified and been there with what I'm calling the most important stakeholder in stakeholder capitalism, the communities.
Very interesting points there that you raise, Myriam, but we'll need to take a short break and we'll come back and ask you to expound some of those points. You are watching the CNBC Africa special. You can be part of this conversation. Tweet us at CNBC Africa. We'll be right back after this break. Welcome back to a CNBC Africa special. Now we are having a very interesting conversation on multilateralism and private-public partnerships, also known as PPPs. And with a panel of experts today, we have Siddharth Chatterje. He's the UN resident coordinator in Kenya. We also have Myriam Sidibe. She's an associate professor at Harvard Kennedy School and also co-founder of the Global Handwashing Day. And of course, Polman. He is the chairman of the International Chambers of Commerce and also the former CEO of Unilever Group. Now, before we went into the break, Myriam, you were breaking down some of those exit strategies for private companies, but one that came to mind exactly, and which was your first point, was the business initiatives of the future. And when you talk about business initiatives of the future, we've been singing things like STEM quite a lot in the past, the last half of the past decade. Now, are the education systems on the continent ready for that?
I think more and more, when you think about the kind of trust that's required today, you'll find very clearly that a lot of the millennials today are trusting more brands and companies than they are actually trusting their government. So there is a level of, being able to respond very quickly and keeping some of their needs and understanding that, they've got to say that they will be listened to and that there is an opportunity for them to get involved into some of these conversations. And we've seen that very clearly. So I think for me, the way I see this is, how do you harness this amazing group of youth and this demographic dividend that we have in Africa to be able to be the ambassadors today, taking on their full ownership of making some of these preventative actions, for example, being ambassadors on hand washing with soap into their communities where they're trusted, talking to their peers. I'm really thinking about, today taking into action, saying, are we going to see carnage in Africa? Maybe we will not, actually, because if we are prepared, and what we are taking full advantage of this demographic dividends in Africa, which is the youth coming to the table and saying, can we get to a prevention scale that has never been seen before? Way more in advance before we can see, a peak that is, overwhelming our healthcare facility, and really rethinking about some of the roles that we have, because, prevention and communication towards behavior change is something that private sectors and businesses whose core business have been about supplying soap or hand washing with soap or trying to drive changes by having dynamic messaging is something that's been done for decades. So they know, and they will be working with this amazing group of people that are in our education system that will be able to say, look, here's what I can contribute. I think what we're dealing with right now is trying to make sure that we're not, feeling too powerless, that we actually give it back to some of this youth and this, this group of people to say, what can they do as well as this pandemic is coming to the future? Staying at home is one thing, but keeping each other accountable to stay at home if you're going to go hungry is another question. And I think this is the kind of conversations that we're currently seeing in Kenya through the National Business Compact, and that we're doing a lot of work on, harmonizing and getting the tech companies in Kenya to come together to the table and to say, what can you do to digitally enhance and work with some of these youth and some of these populations so that they can get involved, not only in reminding themselves on the key moments to practice this behavior, but also to get vouchering incentives that will keep them rewarded for doing this socially acceptable behavior. Because in Africa, we're going to need to make it socially acceptable and rewarded, because it's a really hard thing to do. It's really hard when you have bailouts, as we've seen in Europe, but let alone when you don't have an economic bailout in Africa, and your daily livelihood depends on your ability to comply to some of these behaviors. And we need to realize that it's not going to be an easy task. And this is where the private sector can reward, enable, support. And this is what's going to actually lead the private sector to stay resilient through this time. Because we need to keep in mind that obviously, a lot of the employment of some of these communities and youth will be through the resilience of some of these companies to actually survive this crisis as well.
Myriam, do you believe that this is going to bring an overhaul or a need of an overhaul in the education system of so many of the countries on the continent?
I mean, do I believe that the businesses are going to do? I think that's a very hard question, because I think there is a role, obviously, on employment. There is a role in shaping the way we speak to our youth and encourage them to stay in employment, in an education system. I think the role of education still lies primarily with government, and that's my firm belief in terms of setting out what needs to be done. And then I think in supporting the leadership of this government, where the businesses community have a role in strengthening and making the rewards in education. But today, what we're looking at is, people are not going to school. There is a halt in terms of education. There is a halt in terms of employment, and there is a halt in terms of, social interactions, which we're now trying to recreate through, digital platform, through rewards, through understanding, creating digital WhatsApp group where we can keep each other encouraged in staying home and in checking each other's behaviors to see whether we're wearing masks on the way out. Can we recreate a new economy around, getting people to manufacture their own masks, locally, to create their own hand washing facilities? Because we've seen that, 60% of compliance to hand washing behavior is the ability to have soap, water, and a hand washing facilities in the same place. So it's as simple as this at the moment. It's, even in countries where they have running water and soap, the practice of doing hand washing with soap is extremely low. The global rates are less than 19%. So imagine in places where, there are 12 people sharing one room that will not have a toilet to be able to share, and definitely not having access to a sink. So how do you expect the practice and the compliance to hand hygiene, as basic as that is? And I'm sorry to take it back so basic, but I think it is really important that we keep in mind, what are we talking about in terms of what the education is required, but most importantly, less than education, what the compliance and how difficult the compliance is going to be.
Sid, what are some of the actionable items that countries can do, like right now in this case, to help end the pandemic as soon as possible?
There is nothing better than prevention, and prevention is going to be mission critical. And that is why often you'll find leaders who repeatedly say, firstly, or everybody, doctors, scientists, that, washing your hands, maintaining proper respiratory etiquette, keeping physical and safe distancing, listening to the guidance given by governments. And I think those are the preventative ways that will flatten the curve, particularly for Africa. We do not have the bandwidth to take the kind of shock that the big five that I mentioned earlier, Italy, Spain, France, UK, and the US took. There is just that capacity is not there. So it will have to be an effective preventive strategy. And having said that, I think now is the time for the world to come together, for leadership, political leaders to come together, for religious leaders to come together and say, look, this global pandemic has shocked the system. Nobody expected that the scale and magnitude. I mean, today, the United States alone is catching up with the same casualty figures as they lost in Vietnam, for example. Today, we are at about 55,000 people who've died in the US. This is unacceptable anywhere in the world. Not even a death in Congo or a death in the US or a death in the UK is acceptable because of a preventable disease. But preventable diseases means that we have to get the right systems in place. And that system means really coming together around what the world community agreed to in 2015 on the global goal of SDG 3. And for SDG 3 to happen, or universal health coverage to happen, there are many other things that need to get into it. There's the issue of climate change. There's the issue of exponential population growth. There's the issue of sexual reproductive health and rights and safeguarding that and making sure that, all pregnancies are wanted, all pregnancies are planned for in a better way, and making sure that at the policy level and at the practical level, the ones that Myriam is talking about, we need to end poverty so that people do have the capacity to go to Unilever and buy that Lifebuoy soap. We need to have people who should not be going hungry simply because of poor planning. All this contributes towards the advancement of SDG 3. So, we need a new ecosystem of leadership, a leadership like Paul Polman. That branding, that DNA at the private sector level, CEOs who see the global good and see that as an opportunity for growth. Because without growth, you will not see the global good happen. So it's intermingled. And that is why we need an entire new leadership at the political level, at a leader like the one in New Zealand, Jacinta Ardern, who can see compassion combined with opportunities, combined with mandatory restrictions, can all come together and balance each other out. And that is why I think when the Secretary General, who's really been a champion at the frontier on against this pandemic, has really been galvanizing the world to come around it. This is the time. It's only through a crisis do we get an opportunity, and that opportunity for change is now. So as George Bernard Shaw says that, he said, some men see things as they are and ask why, and some dream things that never was and ask why not. I think we now, as a world community, as the United Nations, as the private sector, as governments, as society, have come to that point, to that inflection point to say, why not?
Paul, you've previously been a head of cooperation, and let's look at this for a minute now. Such a crisis, will this push competing players in the, let's say, corporations to work together closely?
Well, I think this crisis is showing the fragility of our current economic system. This is worse than what we saw after World War II that Sid was referring to. 30% of the SMEs risk going belly up and disappearing. We see unemployment levels going to 20, 25%. at the current rate, and the numbers are going up in most countries. Many of them will not be restored to former levels. The youth disproportionately affected, and so are women. So this is a crisis of proportion that needs different answers. It's interesting, in a recent poll in Europe, that 90% of the people said, we don't want to go back to the old way of doing things. And 85% of the businesses say, as we move forward, we need to go to a multi-stakeholder model away from the shareholder primacy model. The businesses that were least prepared for this crisis were businesses that were myopically focused on the shareholders, with share buybacks, with special dividends, with enormous compensation schemes related to the CEO or a few favorites in the company. And these companies are suffering now. They don't have the financial stability, they don't have the trust, they don't have the relationships and the value chains that you need to solve these complex problems that we see today. And frankly, they don't have a contract with society, that society really decides not to leave them around, is something that is quite obvious to me. So I think you'll see a different type of business emerging, a business that understands their social responsibilities, their environmental responsibilities, and actively is playing part in these transformative changes that will be needed. The crisis has taught us that we cannot have healthy people in an unhealthy planet. And the planet is certainly unhealthy. So one of the transitions that we need to make is towards a green and more sustainable future, as we've talked about. It is cheaper, the jobs are more secure, it creates more jobs, and it's actually for the resilience of this world an absolute must. If we stay on the trajectory of climate change, as we saw before the financial crisis, then the incremental costs at the end of the century are estimated between $600 to $800 trillion. The world can't afford that. So we need to transform our energy system. The second thing we need to do is transform our food system. What this has shown is the underbelly of the economy. In Africa especially, many people will be stressed in a dysfunctional food system. On top of that, in East Africa, you have the locusts, you have the worms and other things. You have your conflicts, your climate change already affecting this, and other insecurities. Not surprising that 826 million people still go to bed hungry, not knowing if they wake up the next day. We are now convening with Imagine, the new organization I created, a group of leading companies in the food chain to hopefully bend the curve on food. And we need to look at social protection, as you've already seen. Many companies are held to higher levels of accountability, even by their shareholders, to ensure that people at least have the minimal social protection, including health care or sick leave, or minimum livable wages, for heaven's sake, when these economies get some of these pressures. So these are major transformations that need to happen. And then I think it is time that we look at our global cooperation and financial systems. It is a scandal that it took us so long to just postpone debt payments in Africa. Africa is already fragile. They've seen 80 billion money leaving. They don't have lending capabilities in the financial markets currently. They're pressured because tourism is down, oil prices are down, remittance is down. So if we don't even have the courage globally, when we spend $5 to $10 trillion in economies in Europe and the US to keep it even alive, if we don't have the courage to spend a few hundred billions to the emerging markets or to cancel the debt and certainly help with the plans now to face this current crisis, then you wonder what humanity has come to. So I hope that we can rise to that challenge and also show more solidarity on a global level when it comes to functioning financial markets.
Paul, what do you think is going to be the fallout there? Are we going to see more mergers, or it's going to go to each their own?
Well, what you see is definitely there is some acceleration of trends that you've already seen. The trend in technology adoption, home delivery, like e-commerce, education, all these things might actually be advanced and create a slightly different world. And these were the current trends. I also think there will be new trends. We've seen people rally together. We've seen partnerships being formed, even in the private sector, that were not possible before. Fashion companies that went together and produced masks, consortiums of companies producing ventilators. many other companies going together in healthcare, hotels going together, turning them into hospitals, etc. I think these forms of partnership we will see in the future more. We will see consolidation of industry, regretfully, may I say, because there are many of the weaker ones that will not survive the current crisis. And we have to be sure that as we get more concentration in industry, that it doesn't have the negative economic consequences that are often associated with oligopolies or monopolies in that sense, but that we can create economies that are actually even more functioning around the multi-stakeholder, longer-term focus. And that is where the Chamber of Commerce is focused on, without any doubt, to create that. And that's why we're calling, especially now, for extra support behind the SMEs, the small and medium-sized enterprises that really have not been very well supported in the current crisis. The bigger companies, I'm less worried about, but it is the smaller companies that we should be worried about. And yes, this is the moment to finish off that we will see a major transformation where old industries of the past, like coal or like fossil fuel, will be definitely the industries of the past, and where new industries like wind and solar and other forms of green energy will indeed be the companies of the future. And that creates that more resilient society that I think we're all aspiring to create.
Myriam, there's been a kind of a wake-up call to some countries, and Africa being one of those that many see that could take advantage of this situation. And here we're talking about in regards to China's position in the value chain, China being the biggest manufacturer in the world. You have countries like Japan that are creating incentives for production to go back to those countries. Now, if this is happening to countries like Japan are going this route, what do you think is going to be the fallout for China in terms of position in the value chain after COVID-19?
Well, I think we are seeing, the biggest import that we see in Africa, and I think, is obviously products that are still coming from China and that are still flooding our markets. And then I think, there's starting to be a sense of local resilience and local, basically trying to get manufacturing being stepped up in our respective countries. And you've seen that. And I think Paul mentioned a few of that, but we've seen, our beer factories turning into, producers of sanitizers, for example. We've seen, local sewers and designers turning into, mask productions, for example. We've seen, local community soap makers figuring out what is the best way to have and to create your own, local soaps. But not only that, but also accelerate different formats and SKUs that are, cheaper and more available everywhere else. And so I think what you will see more and more is wherever it is possible that we can rely on own local manufacturing, that will happen. And you can see that. I do think that China has been a good friend in many respects to Africa, in many in terms of a trade exchange at times. And I think it's an important player in the sector because it's capable of producing at such large scale. But I think it's fostering an ability to create an inward solution, which I think will be beneficial in the long term if we are capable of really harnessing that, developing new skills in the making and understanding how that's going to be done. So I think that's something that we can keep at the core of the conversation. Now, I still think that there is an element of learning that happened from South Asia, Southeast Asia, which can be transferred in Africa. Because if you see some of the countries and what they've done, and the reasons why they've seen such low mortality rates, they're experienced with some of these pandemics. And I do think that if Africa knew what Africa knows, because Africa has been through Ebola, for example, and it's important at a time like this to make sure that those learnings are, have a Pan-African approach in terms of, sharing what countries have done successfully, the kind of conversations and ways in which it was done. The way Ebola was defeated was very simple. hand washing in every single household and changing the way we look and feel and challenge our societal norms of what is acceptable and how we normalize and celebrate it, for example, hygiene and the way that that's being done. Now, alongside, obviously, everything else that we're talking about in terms of healthcare system. So if I think about those new relationships, they will be transformed. And I think I don't believe the world will ever be the same. And I think there will be an increased resilience in local businesses and their ability to deliver and support in their own countries, and really understanding whether the ability for raw materials and ability to manufacture can be stepped up in country. That's my perspective, but I'll leave it to Paul and Sid, because I think Paul might have a much more a better view, having been global CEO of Unilever, on this.
Sid, we've seen the push for bailouts in some economies worldwide, but there are some governments that are not in a position to do so. Now, as your parting shots, what's the alternative?
Let me put it this way. Recently there was an article in the Washington Post, and that article actually featured Kenya, where a company in Kenya in a county called Kitui retooled itself and started to produce 30,000 masks per day. This is precisely the kind of retooling that we need with SMEs in Africa. I believe this is where that new potential is going to be. Listen, we need China, we need the West, we need America, we need everybody to be producing, because the global population also is going to be 10 billion by 2050. But Africa now has an opportunity, and African leaders, together with our partnerships with the private sector, the United Nations, and member states, to come together and say, listen, this is the youngest population in the world. It's the biggest demography, where to reap a demographic dividend, we need to make sure that people get employed. That employment is going to start generating opportunities, where households start to get more disposable income. They're able to buy more goods and services, better educate and nourish their children. Bottom line is, we need to find that new avenue, new energy, new enterprise of private sector thriving in the Africa context, which means African leaders also have to enable public-private partnerships to happen, provide those opportunities, because Africa is where the future business is going to be. My friend, all of Europe, the US, just to give you a comparison, Kenya's median age is 18. Sweden's median age is 47. That's the reality. Europe is aging. The US is aging. Asian tigers are aging. Africa is emerging. This is the new line. What we now need to do is reconfigure, retool African industry to serve the global markets. I believe everybody will benefit from it.
Paul, any parting shots? You have 30 seconds.
No, I just built on what Sid is saying. I think this is Africa's time. We need to make Africa food independent. I always have seen Africa as a potential exporter of food, and this is the moment to do it. We need to put in a more robust safety net in Africa. There are 2,000 ventilators now in the whole of Africa, 170,000 in the US. So I hope this is an opportunity that we can put in infrastructures in Africa that are more resilient. And then obviously we need to use this opportunity to ensure that Africa gets the means going out of this. And I've talked about canceling the debt payments and not only postponing interest payments, but also spending a fair amount of money in Africa to ensure that they can make this transition to this more sustainable and equitable future. That's very well explained in the Sustainable Development Goals. We're spending $5 to $10 trillion in Europe. Let's at least be sure that we spend a few $100 billion in Africa, because if this crisis has shown us one thing, that first and foremost, we're all citizens of planet Earth. Thanks.
Thank you very much, Paul, there with your parting shots. Unfortunately, we have to leave this conversation here. We had the UN resident coordinator in Kenya, Siddharth Chatterje, Paul Polman, chairman of the International Chambers of Commerce and former CEO of Unilever, and Myriam Assa Sidibe, an associate professor at Harvard Kennedy School and also co-founder of the Global Handwashing Day. Now, don't forget to tweet us at CNBC Africa if you want to be part of this conversation, or myself directly at The Real Quizera. Have a great day.